It's a pleasure to welcome you back to another episode of Medicine and the Machine with my co-host Eric Topol.
We're going to be talking with Eran Segal from Israel today about the pandemic and beyond. So we're really fortunate. So Eran, welcome.
Thank you very much. Thanks for having me.
Well, you've been a leading light in the pandemic and specifically in showing the way Israel's gone through quite a bit with 3 lockdowns, the most aggressive vaccination program in the world, and all sorts of other things. So maybe could you give us kind of a overview of what your thinking has been over this year?
Yeah, well, obviously for us and as for the rest of the world, it's been an incredible year. So much has been going on. I guess Israel, I think overall did a few good things, which may have also happened by happenstance, and then overall, I think did not do a fairly good job at handling the pandemic, and I think in the end has had tremendous success in the vaccination rollout. This, I think, really has been a great success story. I would say, just when the pandemic started, the one thing that Israel did really well was to just close down the borders. Israel is we view it as a kind of an island country, only one entrance to the country, so it's relatively easy to shut down the borders, unlike say Europe, where you have lots of borders for many countries. And that actually saved us from the first wave here was now in retrospect fairly mild, and we exited that wave with actually very few cases, and that held up for a while, and then cases started rising, and I think we saw where the outbreaks were, but we were not able, for various political reasons, to shut down and impose restrictions on those outbreak regions. And then cases started rising. We defined a capacity threshold for the healthcare system. I think it's like with many things, when you define a threshold, you're bound to reach it, and that's what happened. And so just when we were about to reach the 800 beds in the ICU simultaneously, we imposed our second lockdown. That took a longer time to have an effect because the cases were high and hospitalizations high. We performed a research that showed that actually, even before reaching that capacity of 800, even when we were at around 500 or 600, when we analyzed the data in retrospect, we saw that during this load in hospitalizations, there was actually, we weren't giving patients the best care. And we estimate that we had about 25% excess death in the ICU during these times of hospitalization. So COVID mortalities that could have been saved if these same people, given their age, given their status at hospitalization, were to come during periods of lower load on the hospitals. So that really took a death toll. We exited the lockdown. We opened things very quickly because there was a lot of pressure to open things up. Then came our third wave, but at the same time, the news about the vaccines working came out, and so when we calculated and put together our models, we thought that if the vaccines come, despite the rise in cases that we had, we could have defeated and crushed our curves without even imposing a third lockdown. But then what happened is now we're getting to around mid-December, the UK variant, the B117 variant, which now we understand infects in a higher rate, maybe 30, 50% higher rate, arrived in Israel. Again, a mistake in not monitoring our borders closely enough. and our single border, not monitoring it closely enough. And then when we recalculated the models with a variant that's 50% more infectious, then we immediately saw that no matter which parameters you put, all the sensitivity analyses showed that you won't be able to beat this spread, even with the vaccines, even with the speed of vaccines that we were able to roll out the program here, even when you assume the very high optimistic, which hopefully will end up to be true, but the high optimistic 95% efficacy for the vaccines. So we recommended that we go into lockdown. Other experts recommended as well. We did that. I think that saved really it saved a huge surge. We still saw a rise, but this is despite the lockdown. We saw a rise in cases. So we can only imagine what would have happened if we didn't go into lockdown, given the UK variant, which by now is now we estimate is around is pretty much the variant here. It's probably in 80-90% of all cases. This, I predict, will be happening all across the world as this variant spreads to and is already spread in other countries. And in parallel, we saw the number of beds in ICU rising even further. We were steady at about 1,200, which is way over our capacity. We recalculated and saw that now we believe there's around 30% excess death going on for quite some period of time. This is now really a lot of lives that really could have been saved in different times. The hospitals really are beyond capacity. But I think the optimistic news is that now, for the past several weeks, we have been seeing, and I believe we're the first country to see it because we're furthest ahead, we began to see the vaccines having a real impact on numbers of the pandemic. So the vaccination rollout program here in Israel was amazingly well. We started in late December. We thought that we'll go at a pace of about 50, 60,000 people a day, which is a bit less than 1% of the population. But at the peak, we actually vaccinated 250,000 people every day. If you translate that to the size of the US population, you have to multiply that number by 40. Yeah. So that would amount to 10 million people that you vaccinate every day. It's really amazing. And so I would say that kind of 3-4 weeks into the program, we began to see the numbers going down. We didn't report on it because initially you don't know, you don't have the confidence that it's is it noise, is it real? But now in retrospect, when we analyze the data 3 weeks backwards, we can say that it's really the vaccines having an effect, and every day the trend continues and further improves. And what we are seeing is that when we analyze the group of people who are 60 years and above, that's the group that was prioritized in Israel to get the vaccine first, we see that since their peak in mid-January, there's now a 55% reduction in cases, 40% reduction in hospitalizations, and 35% reduction in critically ill patients, and also now even 35% reduction in mortality. So this is really good news, and compared to the group that's below the age of 60, which were later to vaccinate, we don't see the trends there. In fact, if anything, we're still seeing an increase in hospitalizations, and this is because of the overall surge that we had and the limited success of the third lockdown here, given the battle against the UK variant. But I think that we're now turning the curves. I think we're beginning to see the reduction now in the next age group to vaccinate, the people who are in the 50 to 60 year old group. And so there's some optimism, I would say. Yeah.
Well, that's rich. I'll turn it over to Abraham. I have a list of 50 questions, but go ahead, Abraham.
Well, I think this is remarkable data, and the world is really looking to your data to project what could happen. Is it a function of the completeness of the vaccination that you think you're seeing these benefits in mortality? In other words, do you think that here in America, with our schedule being not far from complete, would we start to see the benefits in the way that you are?
Yeah, that's an excellent question. I think we were a little bit, I think we expected results sooner. But in retrospect, I think we didn't take into account and didn't consider certain biases that I believe we're starting to see them all over the world, including the US, which is having to do, first of all, with who are the people that go and get vaccinated first. I think it's really the people who, to begin with, are more cautious. And so vaccinating them from the pandemic perspective has less of an effect. That's number one. Number two is we're seeing that regions of outbreak, in general, in those regions, people go less to get vaccinated. So it's those cities and regions that had lower rates of infection. Those are the people also, those are the regions that got vaccinated first. Obviously, you would want the opposite from the pandemic perspective. So I think those are key reasons. Now, it's also possible that this UK variant, we still don't know, but I think now we could maybe say that it's also not just spreading faster, but may also causing a more severe disease. So the chances, if you got infected, of you becoming hospitalized or critically ill, I say this with caution, but I think the numbers are showing that it may cause more severe disease. So that's kind of offsetting the effect of the vaccine. And finally, we don't know this yet, but it's possible that the first dose has less of an impact compared to what you see in the Pfizer graphs in the data, which, if you analyze them carefully, they would suggest a 90% efficacy even after the first dose. I can't say that we're not seeing that, but I'm just saying maybe that's also a reason why the effect was delayed. And I think you really have to get and try and vaccinate as many as you can from the high-risk group. So when we do the sensitivity analyses, we find that taking that extra mile, really finishing the vaccines from managing to get not just to the 80 or 85% of the people above the age of 60, but really going to the 95%, even reaching close to 100%, that could really have a major impact on the death toll and overall hospitalizations from COVID.
Thank you.
We're learning so much from you and Israel, Eran. I think the B117 story, of course, was just beginning to unfold here. You have that, as the strain now, and we're at worst 10% perhaps in Florida, and we haven't really had to reckon with it yet. The other thing you've emphasized from this is, since it's the medicine and the machine name of the podcast, is how the modeling here has helped you and predicted in a way that vaccination could help. You could kind of vaccinate out of this mess in some respects. The other thing, of course, that we knew from the beginning of the pandemic was it was vital to flatten the curve because of the overwhelming of medical resources. You validated that too. I mean, you're kind of the leading edge of the pandemic in so many respects. One of the questions that's come up is special groups like the Orthodox, the Palestinians, even though you have much better buy-in to the vaccine in your country, you don't have the anti-vaxxer, dominant voice that we have here. Can you tell us more about how do you deal with these other important groups of people that are, you have a lot of heterogeneity there?
Yeah, that's actually so. Despite all of the success we just talked about on the rollout of the vaccines, yes, we do face this problem of still we have 10% of the people above the age of 60 that didn't go and get vaccinated. Were for the past 4 or 5 weeks, we're kind of stuck we haven't made a lot of progress on those about 150,000 people that are left. And when we analyze the data and we say, okay, what would happen if we had an uncontrolled pandemic now? What would be the casualties? We still find that even today, 2/3 of them would come from this group of 150,000. So it's really critical to get to them. And I would say, yes, we have an issue with the Israeli Arab population. Only about 65% of those who are eligible to go and get vaccinated in the high-risk group went and got vaccinated. It's a low number when you consider the fact that for the individual, first of all, it really, I mean, we see now that it really saves lives. And not to mention that also it allows us to exit the pandemic. Similarly, in the ultra-Orthodox, it's a bit better, but it's still at around 75%. And comparatively, in the general population, it's now 94% of those eligible that went and got vaccinated. I think we should do better than even this 94%, but that's actually a fairly good number now. So I think the issue is, yes, we do have people who are still advocating against the vaccines. Of course, nothing of what they say has any basis, but we still have these voices here. So I think that's one battle. The government has now allocated some funds for educating the public and reaching out to these groups, and I hope this has an effect. But so far we've been stuck there, and I think the majority of cases and hospitalizations that we still see among these age groups are coming still from those who did not get vaccinated. So it's really the impact of the vaccine has been tremendous. We just have to go that extra mile, and there's a lot of effort being done on that. One of the things we've said is that until now, the health medical organizations, they really rolled out the program amazingly, but they put out centers and waited for people to come to these centers. This worked very well with the first people to come, but now we're saying, okay, now it's time for the health organizations to go and just knock on the doors of those people who are left. It's we can do such an operation in a matter of a week or two. And I think the majority, if you come to them, they will agree to get vaccinated. The other thing is, I'm sure, as I know is the case in the US, in general, people of lower social economical status are, in general, they get more infected. Those are the outbreak regions. These are people also that have a harder time to lose a day of work to go and get the vaccine. They need to use public transportation. So it's just more difficult for them to go to these centers. So we have to now go to them because that can really save lives and lower the pandemic numbers.
Medicine and the Machine will be right back.
Welcome to Medscape's latest podcast series, Medicine and the Machine, featuring Medscape's editor-in-chief, Dr. Eric Topol, and master storyteller and clinician, Dr. Abraham Verghese. Remember, you can find the latest in medical news, expert perspectives, clinical tools, continuing medical education, and more at medscape.com.
You obviously have wonderful data on who's getting vaccinated, who's not, and then what happens to them in terms of their hospitalization and mortality. What other data are you collecting? Because I imagine this is a rich opportunity for all the rest of us to truly understand what's going on. Are you collecting antibody data? Are you collecting, what else do you have that we might look forward to?
Yes. So there's a lot of data on side effects of the vaccines that our Ministry of Health has been publishing. They're doing serology. So they've published some of those results. Excellent results, by the way. 97% of people who were vaccinated, they detect antibodies, and the levels go up after the second dose in the majority of people. And the health organizations, I think this is one of the unique aspects of Israel, why the program was rolled out so quickly as well, is first of all, we have a centralized healthcare system, and there's 4 organizations, and by law, you have to be a member of one of them. And so, it's just it's a small number to control, and the logistics of it, and all of them are linked electronically to health records. So one of the things that I think will be coming out very soon is also links between those who got vaccinated, what happens to them in terms of hospitalizations, does it have to do with any background diseases that they have, and so on and so forth. I think this is a unique data set, maybe also part of the reason why a deal was struck between Pfizer and Israel, to have Israel be a kind of a signature country that can really roll out the program quickly, and also has the data to analyze and provide a lot of insights on what's going on.
Do you have a sense about long COVID from the whole pandemic in Israel? Is it a 10%, or is it a significant disability in a proportion of people?
So we don't have hard data on this yet. Obviously it exists, and we hear a lot of reports on that, but it hasn't been collected yet in a systematic way. I think that's one concern for sure. We're also concerned now that we're vaccinating during a surge of the pandemic, when we still have a lot of cases, and obviously this puts a lot of pressure on the virus to escape the vaccine. We heard reports from the UK that on several independent events, the B117 can acquire a mutation that's present in the South African variant, which renders the vaccine less effective on it. And so there is a concern now that we have such a big spread still. We're still detecting new cases. Over 0.5% of the population every week is newly verified cases of COVID-19. So it's still a big number. So we're concerned about that, and we really want to bring down the numbers.
I think you're emphasizing something that, again, is a vital teaching point about how, even though you've had such great success in the high-risk group that you vaccinated, there's still a proliferation of cases, and B117 is a beast for sure. I wonder if you could just speak to the B1351 South African. I think it's present in Israel. Will it be overrun by B117 so it will not become an issue, or because there the immune escape seems to be real? It's a concern, and if that one gets into high spread, we're also got another version of trouble.
Yes. So we did detect the South African variant, but still at low numbers. And so far, and that's what we know right now. One of the things we said is that hopefully there will be very, very few cases of people being hospitalized after getting the vaccine and after having sufficient time from the second dose. But what we said is that in those hopefully rare cases, we should sequence the virus in those patients to make sure that that it's not a variant that either is the South African one or the UK variant or the B117 that acquired a new mutation, or just an altogether newly evolved strain, given the high vaccination rates that we have and the big spread of infection. So I think that could be a smart way to monitor and really catch in real time the situations where maybe there's a variant that has escaped.
Well, one thing I was going to say, the Weizmann Institute, where you work, is one of the most extraordinary places in the world. The science contributions, not just during the pandemic, but so many things that you've done to help us unravel the mysteries of the gut microbiome, and if it's an omic, it has something to do with, or if it's the immunology, something to do with Weizmann Institute. Can you just tell us a bit about the relationship between you, the Institute, and your Ministry of Health and Government? Do you have frequent crosstalk? Is there a Tony Fauci there? Or are you Tony, or how does it all work?
So as I mentioned, we have a centralized. The Ministry of Health basically is the authority, and obviously they report to the government, and they're really the official body that manages and leads and directs and decides on the pandemic. And by and large, people follow the guidelines. Of course, there's not the public, not always all the time, but and they hold all the data. We've been collaborating with them. It's really there's several scientists that have volunteered for this. There's no official. We're not officially affiliated with anything. I could stop working on this tomorrow. I don't have a commitment to do this, but we just got very interested. And as we got interested and we engaged with the Ministry of Health and with cabinet members and the government, I think we had an opportunity to contribute from the work that we do on data analyses and so on. And obviously, it's not just us. There's several scientists that are doing this voluntarily, and so we advise them, and we appear frequently in the cabinet discussions, which I think are going nicely in the sense that the Prime Minister and the cabinet members, they hear all the time. They hear the reports and overviews of who they consider to be experts, and those experts give them advice. Many times we agree with each other, sometimes not entirely, but it's good debates. It's real, professional scientific debates on what we think is going on. I think we learned a lot of lessons in modesty throughout this pandemic. I would say, when we started making predictions, we wanted to take baby steps. So we said, let's predict what will happen in a week. And when we started that, people said, well, it's not interesting. Everybody knows what's going to happen in a week. And then we took, there's 4 groups who are making predictions what will happen next week. And very frequently, one group says that the pandemic is going to shrink next week. Others say it's going to go up. And it really surprises, because there are so many unknowns here. Really so many unknowns, some having to do with just parameters of the virus itself. If B117 is 30% or 50% more infectious, it really makes a ton of a difference to the what will happen. If the vaccine is 95% or 91% effective, it really has a huge impact on what will happen. And it's very hard. Obviously, you can't know what the parameters are. So with time, we learned more and more to do these sensitivity analyses, and also learned that it's okay and even better, to come to the government and say, we don't know. It could go one way, or it could go the other. When it will happen, we'll be able to analyze in retrospect and tell you why it went this way, not the other way. But right now, we don't know. And so we want to reflect this uncertainty to you when you make a decision, so that you know how to take it into account when you consider all the risks.
Yeah, I know that you've spent a considerable time at Stanford and as a postdoc and for your PhD. All through this pandemic, Eric and I have commented on the fact that, the triumph of the science has contrasted with the disarray of our social responses, societal responses. Do you have any observations, comparing what you read about happening here versus in Israel in terms of how social responses shaped the epidemic?
Yeah, I think in that sense, it seems that a lot of places in the US didn't fare that well on that. And I would say that is also the case in Israel. I could give the ultra-Orthodox population, for example, here has had a huge surge compared to the general population. And this really also had consequences. So when we analyze the numbers now, you see that in the ultra-Orthodox here, 1% of all people above the age of 60 have died of COVID-19 from the ultra-Orthodox population here. That's 3.5 times more than in the general population in that same age group. Israel has now 5,300 deaths from COVID-19. And so if in the general population, we had a spread of the disease as occurred in the ultra-Orthodox, we would have had by now 7,500 more deaths just in that age group in the general population, which is an incredible number. So all the time when the pandemic began and some of the projections said, if you don't control it, it'll be a catastrophe. People said, and then it didn't happen because measures were put in place and people obeyed it in some parts of the country. People said, you just scared us unnecessarily. But now we see, no, it's not the case. It actually happened. If people were not careful in the general population and they let it spread like they did in the ultra-Orthodox, when they still had held a lot of events and funerals and weddings and so on, we would have had a much higher death toll.
Right.
I will say also that I think it's not just that population, and also that population we also have to acknowledge that they have much more difficult objective conditions. So they have bigger families, they live in higher population density in general, and obviously those are parameters that will affect the spread of disease. But I think that also when we look at the numbers now, I think the behavior of that group was not as cautious as the other groups. But also, in the other groups, you can, with a good societal behavior and response, you can control this pandemic. We've seen it happen in several countries. I think Israel should be compared to, not to European countries, but should be compared to New Zealand, Australia, countries that have, a similar political system maybe, and also kind of island countries with a single border. And when we compare ourselves to those countries, we're not coming even close.
Right.
Okay, so in that sense, I think there's a lot of justified criticism to how we handled the pandemic, and we can point to specific things that we didn't do. And I think when the government when you see your government not doing what needs to be done, like locking down certain outbreak regions and then waiting for them to spread to the rest of the country, that also damages public belief in the government, and that also has an effect on how people behave.
Yeah, no, a very important point. So it's late at night in Israel, and we're really appreciative for Eran to stay up with us. We could go on all night with our questions. We're learning every day. If you don't follow Professor Segal on Twitter, you're missing out. All eyes are on Israel. He is a great window into what's going on there. So we really appreciate your taking the time with us in your evening. Eran, we'll want to get back to you again because there's just so much that we can learn. And hopefully that we will adapt to rather than just watch because there's a lot going on there. And just the praise to you and your colleagues, the voluntary work that you're doing to help the government, to help guide, and that they listen, that they follow this. And, this is having a big effect. Obviously, it will, well beyond the citizens of Israel. So thank you. Thanks for joining us.
Thank you very much for having me. Thanks a lot.